Hi, I'm JP. I'm one of the pediatric sonographers here at Children's Healthcare of Atlanta at Eggleston. I was hired here in May of 2019, right out of school. I had about 5 months of training, and then I started the overnight shift by myself. We are a level 1 trauma center and one of 3 pediatric trauma hospitals in Georgia. Some of the exams that we do here are pylorus, intussusception, abdomen Dopplers, kidney and liver transplants, liver contrast studies, cranials, appendix, elastography, upper and lower, extremity Dopplers, transcranial Dopplers, hips, spines, just to name a few. So it's pretty specialized here, and that's why the training lasts for so long. It can last for up to 6 months, I believe, but mine was about 5. So some tips for pediatrics. The first would be patience. We need to have plenty of patience. A lot of these children are in a ton of pain and they don't want to be touched. They might even try and push the probe away. So it's important to stay calm, speak in a low, sweet voice, and explain what you have to do and why you have to do it. And you might have to ask a parent for help. If it's an autistic child, you'll have to ask for what coping mechanisms they use. You might even have to ask a parent to help hold the child. If it's a baby on the floor, you might have to ask a nurse for help. So you might have to ask other people for help if you just cannot do it by yourself. It's hard to do a Doppler on a popliteal of a baby who's kicking and screaming. So you really need to ask for some help. So it's always good to have some distractions. There's TVs in every room that have cartoons going, but a lot of times it helps to have the iPad and just put it right in their face. Or if it's a baby, something like this, something flashy that will take their mind off of what's going on. Sweetie is a sugar water, and it helps babies stay calm, stop crying. And pacifiers. We're always stocked up on pacifiers. A lot of times parents forget to bring those. So you'll be dealing with the parents also, and most of the time they are cooperative and understanding that you cannot give results, but sometimes they do try and demand an answer from you, and you have to remain firm but polite that you cannot give results. Only the radiologist can give results, and if it's an outpatient exam, those results will be available to them within 24 hours on the My Chart online. Or if it's a stat exam, the results will be available to their doctor in the emergency room in the next 1 or 2 hours. But you should never give results to parents. And most of the time they'll understand that. But they will understand that after you tell them politely and firmly that you cannot give an answer. So you should read the patient's chart thoroughly and look at as many priors as you can, and get a good history from the parents or the patient if they're old enough. And you should be prepared to answer any question that the radiologist has, because you will have to talk to the radiologist here for nearly every exam. And you should get through the exams quickly but thoroughly. So you should know the protocols and know the machine. We use 6 probes regularly, so you should know when to use each probe and what's going to take the best image for that child's body habitus. I think that's it for now. So thank you and good luck to you all. Bye-bye.